Friends, good evening. Dr. Ashutosh Gupta. And the common scenario: 38 years old primary gravida conceived with natural conception, and now she's worried about the aneuploidy, right? So there are two options now to talk about. One is an NIPT, and second is an invasive, right? NIPT is still a screening process, and which rules out the common aneuploidies. CVS is definitely invasive, but it's a gold standard, and we can do a lot of tests, or otherwise we can see the baby in a greater depth, right? तो मैं आपको दिखा देता हूँ. Did the CVS for her, which is a chronic villus sampling. First test is the fish, which is normal, so that rules out the aneuploidy. Second, we have offered for an array, which has turned out to be pathogenic, right? So we have picked up 1.1 MB deletion in 16p chromosome. That involves 10 genes, so this is definitely pathogenic. The pregnant lady opted for an invasive testing. We did the chronic villi sampling. The chronic villi was sent for a fish, which is an early test for a common aneuploidy, which turned out to be normal. So 13, 18, 21 X and Y, they was absolutely normal. So that ruled out the Down syndrome baby. But simultaneously, we have sent it for a 750K array, right? So that has turned out to be pathogenic, in which we picked up a deletion of 1.1 MB and a 16p, and which has got 10 genes involved in that particular region, and which are functional, right? अब कुछ salient features, 1 to 2% ये रिस्क रहती ही है कि कभी भी माइक्रो डिलीशन हो सकती है किसी भी प्रीनेटल सैंपल में, राइट? सो इट इज़ ऑलवेज बेटर सो एज टू सी द बेबी इन a greater detail, right? Had it been a case of NIPT or a normal CVS with a fish or culture, we would have missed on this the 1.1 MB deletion, right? तो ये डिलीशन पे हम मिस कर जाते. दूसरा, क्या इसकी ज़रूरत थी अल्ट्रासाउंड पे? द आंसर इज़ नो. अगर ऐसा लगता है कि न्यूक्लियर ट्रांसलूसेंसी ज़्यादा है या कोई और पैथोजेनिक एबनॉर्मलिटीज़ अल्ट्रासाउंड पे दिखाई देती, तो डेफिनेटली हम ये इन्विजिव टेस्टिंग के बारे में 2 बार सोचते, right? So this is a case in which the baby is absolutely good on ultrasound, right? So not all the microdeletions, they would have something or the other on an ultrasound, right? तीसरा, the reports, if they have turned out to be normal, and then we continue with the pregnancy. In the meantime, within 2 weeks, this array report has turned out to be pathogenic. Now we are telling her not to continue, right? So this is what the life is all about, and so that is what it is. But meaning thereby that seeing the baby or looking around for the fetus in a complete sort of in detail, it is very, very important, so as to see like microcephaly, developmental delay, facial dysmorphism, या seizures, या कुछ global developmental issues which we cannot be identified, which we cannot see on an ultrasound. Ultrasound cannot pick up all these things, right? So it is always better to see the baby in a greater detail, right? So 2% could be the risk of an aneuploidy, or 1 to 2% could be the risk of microdeletions, independent of the aneuploidy being in the background, right? So whenever we intend to do the invasive testing, we always prefer to choose sort of a complete set. Instead of doing the culture, it is always better to do an array, right? Thank you very much for your patient listening.